The first step is to log into the KHAMH Aviation Medical Clinic, and the password is capital C HAPEL Chapel $120. Then the next step, once it's logged in, is to activate the program PneumoTrack. PneumoTrack runs the peripheral device called the Vitalograph. So at the bottom you will see this icon, and that's PneumoTrack. Activate that. As the program opens, it will sense the attachment of the Vitalograph device, and it will start checking the database. Sometimes it may indicate the need for an upgrade, which you can ignore. The reason why it showed the error message is because I activated it twice and it only opens the program once. At this stage, it's my email, fjcronje@gmail.com, and the password is capital PNX@2023 capital ABCD to log in. Once you've logged in, you are now in the hub of the program, and the first step is to verify. In other words, to calibrate the device. So you click on verification recommended and you perform verification. This will now indicate the need to attach the Vitalograph to the calibration syringe. The next step is to connect the Vitalograph to the calibration syringe, and this is done by allowing the Vitalograph to connect with this adapter, and then I always rest it on the cradle so that it doesn't dangle down. And then coming back to the computer menu, you will see there are some entries that need to be done. I don't enter the barometric pressure, but I do enter the ambient humidity, which we can see on that weather station over there, and that is 50%. And the altitude where we are is literally 3 meters. So now it will indicate the initialization of the first stroke, and to extend the plunger, which I then maximally withdraw. And then there's an arrow here indicating that I need to discharge the contents of the syringe into or through the Vitalograph, followed by a stroke back. So the calibration sequence, as you can see here, it's indicating that it's ready, and the instructions are to withdraw the syringe and then inject and withdraw the volume completely. So what I would then do, I inject the volume and I extract. The first one I do at a fairly slow flow rate, just to get a good baseline. If that's accepted, it will indicate so, and then point an arrow to the next one. The next one I do slightly faster, trying to some extent to simulate what would happen during a regular flow volume loop. And as you can see, the volumes are very accurate, with only about a tolerance of 20 milliliters. And the last one I'll go a lot faster. At this point, it often will approve the calibration, or yes, as it has done here, or it may ask for additional calibrations. So here we indicate that the device has passed the test, and we can disconnect the Vitalograph from the 3-liter syringe, which we then place away. So the device is now ready for the patient, and the patient's information now needs to be set up. Now you will notice here there's an icon to escape. When that icon is depressed, it will indicate whether you want to exit and print. I always do, and if the white dongle is connected to both the computer and the printer, it will actually print. But as you can see, alright, so now what we want to do is we want to go back to home, and we are going to now start either selecting a subject if they are already on the database or entering a new one. And so here, just for interest's sake, I'm going to show that there are groups: the aviation, diving, medicals, and occupational health. This is going to be an aviation medical. I'm just going to call the person John Doe. And the date of birth you can either get on the calendar, or you can find your way to whichever year it was. You can either enter it, and I'm just going to make it 2000 for argument's sake. 2000, January 1st. Alright, and then height and weight, so it's important that that is done. Note it is in centimeters, not meters, and the weight in kilograms. Population group, the default is Caucasian. If there is smoking, the number of cigarettes per day and the years they are smoked. If the person's never been a smoker, then you mark non-smoker. If they have quit smoking, you mark ex-smoker. And by the way, gender at birth, in this case, male. So aviation medicals, the calculated age of the individual based on their date of birth and today's date, their height, weight, their body mass index is calculated, the population group, smoker status, and if they are smokers, how many packs a day. And this is then saved. So what will now happen, as we go back to this individual, you will see he's now marked in the space, and if I open there, it's now going to allow me to start the test. And it's a base forced vital capacity. The alternatives would be a post-bronchodilator assessment or a follow-up assessment. And from there, we accept, and we're now ready to do the testing of the subject.